All right, welcome back in. This is right now streaming here on the CBS 8 app. A lot of people have heard about this story by now. We're talking about the Hantavirus. Something that many people prior to this story had probably not really heard of, unless they're really on the depths of Twitter. I mean, this has been a virus that has been, we talk about conspiracy theories, has been the subject of like, well, what's going to happen next after COVID and what's the next disease that can be transmissible via rodents? Well, Hantavirus is a very transmissible disease via rodent to rodent. And there's a cruise ship, a high-end luxury cruise ship who has been the center of what has been a deadly hantavirus outbreak. And now there is a standoff growing about whether and where to send this cruise ship.
Yeah, and oftentimes, these kind of conversations are tricky because, it's important stuff. It has gathered international attention. You're seeing multiple your countries. You're seeing, but you're also seeing international communities talk about this. It's something that is gathering more and more attention on the national news front. We actually have a few updates here as well on top of the notes that I already have gathered here, but let's just kind of get into it. So a standoff essentially is growing over where to send a cruise ship at the center of the deadly hantavirus outbreak. 3 people have been evacuated from the MV Hondias off the coast of Cape Verde, but the Canary Islands of Spain are now refusing to let the ship dock, even as Spain's national government insists it will. Spain's health minister says the ship is expected to reach the area within 3 days, and that passengers currently on board are not showing any symptoms. The WHO, the World Health Organization, is pushing back on the Canary Islands, saying Spain has, quote, a moral and legal obligation to assist those on board. So to kind of talk about the latest, for example, 5 confirmed cases, 3 suspected cases, 3 deaths as of May 6th. Of course, that was yesterday. Only 1 death has officially been confirmed as hantavirus related. The other 2 remain under investigation at this point.
Now, I have a question here for you, Jack, and this is something that I had in my report today, but this is the pushback here on the docking with the Canary Islands. This is limited to the Canary Islands, correct? Because there have been passengers we have passengers in Arizona and in California who are now back home from this ship who are being monitored by health officials here locally. So there have been other passengers who have been able to get off, assuming they're not showing symptoms. But I think that there's something unique, obviously, about the Canary Islands because of, I think, their experience with COVID-19.
Yeah, they said that they were ill-equipped to handle it at the time, and it was a significant stress on the citizens, on the response, on their resources. So at this point, it's something that they just don't really want to go through again at this point. So this is where that standoff is really coming from. You mentioned that there were people who had essentially been repatriated. Of course, people came from multiple different countries who were on this cruise ship. People have returned. And we actually have an update from that because we had a news conference this morning. Sorry if my audio just cut out there for a second. I just wanted to grab my laptop to make sure that I have everything that I'm reading. This is a report from this morning that says more than 24 passengers from at least 12 different countries left that cruise ship that was hit by the deadly hantavirus outbreak. They left on April 24th without contact tracing, nearly 2 weeks after the first passenger died on board. That is according to the ship operator and Dutch officials. They said this during a morning press conference today. So this is raising new concerns, Chris, about how this virus could be spread by people that were returning home. Because like you just said, there was hesitancy from the Canary Islands to let this ship in, let alone. But you saw that people had left. Well, it's not necessarily sure as to whether or not these people may have it or not, but there was just no contact tracing that was done at that time. Even so, the Dutch health ministry said a woman who was not on the ship was being tested and being kept in an isolated ward in Amsterdam after showing symptoms. That person was part of a flight crew, had contact with one of the infected passengers on the plane. Not on the ship. This was off the plane. So if that woman tests positive, she will be the first person not on that ship to have become infected with the outbreak. So that's where we're starting to see some of their concerns. They are starting to do that monitoring there, Chris. Of course, one of the questions that you see with, a situation like this, anytime there's some sort of viral outbreak or these fears, and we've had, a few of these, I mean, they're relatively common. I think the scar tissue of COVID makes it feel like that's always the big jump, but there have been many of this even in my lifetime. I remember, swine flu, H1N1 was a thing, Ebola, obviously we've had,
and even with cruise ships. I mean, if you remember the norovirus outbreak that occurred famously on
Zika virus was a scare for a little bit. So with that being said, of course, all of those instances are serious, and they always require the utmost attention. But I think that there has been, a lot of people, if you go on social media, and a lot of people do that nowadays, you see a little bit of fear mongering. You see some people who we want to know that at this moment, one of the things that you've heard from health professionals is that this is exceedingly rare, especially a type of the hantavirus that is human-to-human transmission. Correct. So we want to keep that within context right now. But Chris, again, like I was about to say, where did it come from is the biggest question. What are we hearing right now about this?
Yeah, so the 2 anonymous Argentine investigators say they have a leading theory right now, and this is one of those that you're just like, wow, really? Okay. So the leading theory right now, a Dutch couple contracted the virus while bird watching, but it's not because of birds. It's because of where they were bird watching. So the virus could have been potentially picked up. According to the Argentine Health Ministry, published a report tracking their 4-month road trip through Chile, Uruguay, and Argentina from late November of 2025 through April 1st of this year, and that they were potentially doing bird watching in a trash dump of some kind, right? Like that was potentially where it is that the rodent aspect of this would come in. And that's something that I picked up here from my sort of the reporting that I had on here today, and that could have been potentially, again, because it's a rodent specific type of virus, and that again, it's one of those things where you're just like, wow, like really, like bird watching got you to this point, to here, to there. And that's potentially where this virus originated from.
I want to get a little bit of insight on this because you had done your own reporting on this. Maybe a little bit of note checking, peer review right now. So it says anonymous Argentine investigators. Do we know anything as to why this is anonymous at this point? Is it just because there's I'm sure that there is a lot
unverified
of unverified information?
Because this is something that they don't.
Totally. So, again, like we said, the Canary Islands pushing back on this, especially when it has to do with their past experiences with the COVID-19 pandemic, and to the people on board. Period. 150 people around there from 23 nationalities. That, of course, includes Spain, the UK, a bulk of the crew from the Philippines, and of course, Chris, here in the United States. So this is something that a bunch of different states here across the United States are already starting to pay attention on. One of those states, of course, is here in California. We have News 8's Brian White has actually spoken to some health professionals here. He did a great piece about this, about what you're hearing from local health professionals.
You asked again why this was likely anonymous, and according to PBS NewsHour, they spoke on the condition of anonymity because they were not authorized to brief the media with the investigation ongoing. But again, this couple visited a landfill during their bird watching tour. Again, I don't know the context behind visiting a landfill, if there's a specific bird that would frequent this, that would bring them to a landfill. But again, that was one of the things where I was just like, wow, really. But again, unverified.
An eyebrow-raising moment.
The eyebrow-raising moment of we had all of these theories about where it is that COVID began, but to have to hear something so specific with bird watching, landfill, et cetera. It's you really do feel for those who were killed in this, because again, lives were lost. I think we should not lose sight of that this is something that was deadly.
And we're gonna have more information on kind of what the virus itself is, what we're hearing about the risks, what we're hearing from various local health professionals. That's one of the great things here is, like we said, California is one of the states that's already been starting some of the groundwork on a potential response, or at least monitoring. I think that's the right word at this point. We don't want a response. We have no confirmed cases here. It's important to keep that in mind right now. But Brian White is nonetheless talking to them. And he's going to join us here with what he knows in his report. We're going to do that after a quick 2-minute break.
All right. Yeah. Again, thank you so much for watching us here on the CBS 8 app. This is Right Now. By now, you have heard our discussion here on the Hantavirus and the cruise ship, the deadly outbreak that occurred, and sort of the repercussions that we've seen on the international stage. Well, while cases are rare, the disease is known to show up here in California, more prevalent, obviously, in rodents. But we're working to answer a lot of the questions that many people have. So our Brian White dug into local case numbers as well as how county leaders track the virus in rodents, and a response from a doctor who's actually treated people who have contracted the virus. Take a listen.
Yeah, those headlines are alarming. It's drawing new attention to this virus that health officials here in San Diego monitor closely. So let's get into how it spreads, who's most at risk, and what current data shows in our area. Hantavirus is rare, but doctors say it can turn deadly.
Hantavirus can be incredibly serious.
I reached out to Dr. Ahmed Salem, a pulmonary critical care doctor at Sharp Memorial, who's treated hantavirus patients before. He says, unlike COVID or the flu, this virus is not easily spread person to person.
Usually it's transmitted through rodents, so usually it's not human-to-human transmission.
Instead, people are infected by breathing in particles from rodent droppings, often in enclosed spaces like cabins, sheds, or garages.
Once you're infected with hantavirus, it can actually lead to severe and deadly disease. It can cause things like cardiogenic shock and ARDS.
Early symptoms can look like other illnesses, cough, fever, fatigue, but doctors warn some patients can decline quickly.
The thing with hantavirus, the ones who are sick will rapidly decompensate.
He says there's no specific cure, only supportive care, and in severe cases, the virus can be deadly. I checked in with San Diego County Public Health. The last detected case was in 2019, and only 4 cases have been reported in the past 2 decades, just 1 locally acquired, but the virus is still being tracked in the environment. The county's vector control program routinely tests wild rodents. I checked, and so far this year, 6 rodents, mostly mice, have tested positive. That's down from 16 last year and 25 the year before. Experts say the main carriers here are deer mice found mostly in rural, mountain, and desert areas, not the common house mice found in urban homes. Health officials say simple precautions can lower your risk, like avoiding contact with rodents, airing out enclosed spaces, and using safe cleaning methods. Again, health experts stress the risk to the general public is low. Working for you, Brian White, News 8.
All right, welcome back in to the Right Now studio, and you will see that our very own Brian White is here with us. So, Brian, I thought that this was an interesting report for obviously a number of reasons. People want to know how it is that something like hantavirus is being sort of tracked, and then also to hear from the doctor who obviously had those thoughts about the disease itself. So let's start with the tracking. The county, the numbers I saw, 6 cases so far, down compared to last year. Was that 16 at this time last year, or was that 16 for all of last year?
As far as tracking it
for the hantavirus and the rodents. Yeah, and the rodents, because we haven't had a human case since 2019, right?
Exactly, yeah. And that was for all of last year, 25 the year before.
Wow.
So it kind of, and 17 the year before that. So it kind of tracks around that. And so we're maybe a little on the low side this year, so far this year.
Yeah, because we're almost at the halfway point. We're about a month away from June. So yeah, looking like we're probably going to be sort of again, depending on obviously how everything goes. What were those conversations like? You're contacting the county, you're asking about this. Were you kind of like surprised by a lot of the information that you were learning about the hantavirus and also tracking it as well too?
Yeah, I was surprised to learn that they track it so closely. And they have the data going back for more than a decade, maybe 2 decades. So I was surprised that they were already on this for several decades. That was the main surprising point for me on this.
Yeah. What stood out to you in your conversation with the doctor, again, from Sharp? It's a rare disease that people can get. So I think it's pretty rare to find a doctor who's treated this in people before. What is his experience with this?
Well, he said that years ago, when he was obviously a young doctor, they treated a patient who had contracted it in Yosemite at a campsite.
Okay.
And the county also told me that too, is they do find positive tests for rodents sometimes in campsites. It's a very common place where they may find it. So someone had contracted it in Yosemite, And they were treating this patient, and the patient did die.
Oh, wow.
Yeah.
Yeah, because he says, like, patients can essentially take a turn for the worse very quickly with this. The very common symptoms are cough, fatigue, fever. Those are symptoms that sort of fit the brand for any virus, really. So how is it that someone like knows to get checked or to test for it? Is there a specific test for it? Do you know?
There is a specific test, but people generally are not going to know to test for it, right?
Right.
Because it's just something, you have to get sick enough to go get checked out. And even then, the doctor's not going to be, that's not going to be top of mind for the doctor either.
Yeah.
So usually what he said was, the way this will go when someone finally gets diagnosed with it is when they do take that turn for the worse, all of a sudden they're in the ICU and they decline rapidly. That's when the doctors, the team of doctors or whoever's caring for them, is then searching for more exotic answers. So they start testing for more exotic things. That's when they pull out the PCR test for hantavirus, and they're testing. It's similar to the COVID test. That was PCR. You're testing for antigens that have the hantavirus in it. So that's how they diagnose it.
And then as for the doctor, or even just the county itself, I know that it's very rare to contract it, but are they alarmed by what happened with the cruise ship? Or what were they sort of saying about maybe potentially what they are seeing take place on that international stage, if anything?
Well, I don't think they're alarmed because they do still feel it's very rare in humans, and they are so on top of the tracking in rodents here in San Diego County. I think that there's still a lot of questions that they have. They don't have all the answers as to how it's all transpired there on the cruise ship. So maybe once some of those answers become more clear, then maybe they'll have more to say about it.
Yeah. Again, the doctor had only treated one patient and it unfortunately died. What were some of the sort of like questions and answers that maybe got left on the chopping room floor that you thought were still interesting enough, but maybe a tidbit or two that you want to share?
Well, I thought that was really interesting of how doctors need to be more aware about this. Because now that it's in the headlines, it may be a little more at the forefront of people's minds, including people who get sick, have some of these symptoms, and may have been around rodents, and some of the doctors who may not initially think to test for that, but now they may give that test sooner rather than later. So I think that's some of the awareness that they're trying to spread about this, so the headlines are doing that.
Okay. Well, Brian, thank you so much. A very important topic. Again, rare, but I think people should know a lot of the facts and figures, especially when it comes to testing here in the county, and then as well as what are the odds of that as well, too. So, Brian, thank you so much for joining us here.